Volunteering is generally considered as an activity where an individual or group provides services for no financial gain. Volunteerism in health is a necessary response to health and inequitable access to health care in developing countries. Nigeria is no exception, with a population of over 150 million and an average ratio of 2 skilled healthcare workers to 1,000 Nigerians. This prompted the launch of Volunteer Safe projects in Lagos to support service programs for volunteers working in the humanitarian sector to ultimately bridge existing gaps in appropriate management of health programs. Speaking at the briefing in Lagos, the founder of Life Foundation, Dr. Matilda Kerry, said, "The Volunteer Safe project is conducting a one-day ethics and accountability in healthcare training workshop for 1,000 volunteers working in the humanitarian sector. This training is scheduled to take place in 7 areas in Lagos, namely Ikorodu, Badagry, Ikeja, Lagos Mainland, Lagos Island, Epe and Victoria Island, starting from February 16th to March 31st, 2018.
The Kerry Life Foundation runs a lot of women's screening, cervical cancer awareness and screening. And we get a lot of cases where women are coming to us for treatment with cryotherapy. And when we take a history, there's been a delay of about 3 months from diagnosis to coming to get the treatment, which is basically unacceptable. A woman that has been diagnosed, that has been screened and seen to have precancer lesions should get her cryotherapy done urgently. So that urgent communication is usually missing. And when you investigate further, you find out that these women were actually screened at community level by some kind of volunteer in the humanitarian sector. So that urgency in management of the client is missing. What do you do when that blood pressure is 200 over 150? Do you just give the man the sachet of drugs that has been given by the NGO and ask him to go home? No, that's a medical emergency. So those protocols need to be in place. The volunteers need to know that they need to have protocols in place when they are going on the field. We also want to be able to provide support services to these volunteers and also the NGOs, because a lot of these NGOs don't realize that certain things need to be communicated to their volunteers. Volunteers have rights and responsibilities globally that they should know. Coming into volunteerism, volunteers should have some kind of liability insurance going out. There should be a conflict of interest policy. It doesn't matter whether you are volunteering for government or you're volunteering for an organization, but as long as you're engaged in humanitarian activities, we want you to be part of this training.
The founder of Health Foundation, Ijeoma Ugwodi, and the representative of the director of Lagos State Primary Health Care Board, Mrs. Sani Afolabi Rashidat, said, "The program is a welcome idea and it will reduce medical negligence among volunteers providing health services to the public."
Looking at the goal and the aims and objectives of the foundation, they are into preventive health. Basically the non-communicable diseases in terms of health education, disease prevention, sensitization, screening, and those are the things we do at the primary health care, making sure that disease is brought to the barest minimum and people can live better life. There will be longevity, and with this is a welcome development, because we know that prevention is better and cheaper than cure.
To volunteer is actually great service, and I don't think one should shy away from being a volunteer, because you're actually rendering service that you're not getting paid for. And I believe that there are really some benefits to it, and one most important benefit to it is the joy that you have that you're helping someone out that probably cannot help themselves. So I think it's a good thing to be a volunteer, and I think this initiative is a laudable initiative in Nigeria, and I'll encourage as many as can to be a part of it, whether to support it or come and even get training, because I believe in life that learning is a continuous process. We're hoping to train about 1,000 volunteers in Lagos State, and we've been able to get registered over 1,000 people, and we're hoping that they will all show up. And this first edition is taking place in about 7 local government areas in Lagos State.
Already having some help from the Lagos State Primary Healthcare Board. They've been very supportive of the project. They are helping us to facilitate at the local government level to ensure that we have seamless training going on from now till the end of March. But we also want more input from the government. We are hopeful that they will adopt this project as part of what they do, because there's 1,000 volunteers that we're training. We haven't even taking a pinch out of the volunteers that are available in Lagos or available all over Nigeria. The United Nations has mentioned they truly believe that volunteers are untapped resources in sub-Saharan Africa. So we really need to look into this sector. We need to start making these decisions about volunteers in health, volunteers in the humanitarian sector, so that we can begin to enjoy better quality of care at the lowest level, at the community level, because that's where you see most volunteers functioning or working in Nigeria. So we really need to think about it and start improving healthcare.
Volunteer Safe Project is an initiative of the Kerry Life Foundation and is supported by Young African Initiative, the Mandela Washington Fellowship, the U.S. Consulate, and the Lagos State Primary Healthcare Board.